This is an ultrasound study of a 55 years old female, and she is suffering from cirrhosis of the liver, and chronic liver parenchymal changes are quite evident. This is the gallbladder. Walls appear thick due to diffuse parenchymal changes of the liver. As itself, the gallbladder is normal. This is the IVC. This is the diaphragm. And now see the echogenicity of the liver, coarseness of the liver, diffuse increased parenchymal echogenicity of the liver. See, diffuse increased parenchymal echogenicity as well as coarseness. This is the portal vein from inner to inner, measuring approximately 9.1 mm, is patent, and this is the kidney. Kidney is fine. This is the liver texture. Now you can see the coarseness and blurring of the vessels, margins. However, there is mild irregularity of the outer surface of the liver. See, this is the liver outer surface, and it shows mild irregularity. The pancreas is okay. This is the portal vein and is patent. This is the aorta. Siddiquai. This is the left lobe of the liver in transverse section. Liver is not in line, is within a normal dimension. Well, this is the spleen. Measures 5.4 centimeters and is relatively small in size. I think up to 6 is considered 6 centimeters is considered to be lower limit of the normal. This is the kidney on the left side, left kidney. There is no evidence of para-aortic gland adenopathy. Now when we go towards the pelvis of this female, and you can see that the urinary bladder is not adequately filled, so have to try to get the organs somehow with pressure technique. Now you see, this is the urinary bladder and this is the uterus of this menopausal, postmenopausal 55 years old female. So the uterus is with a normal dimension. Now there is some ascites also. Ascitic fluid is seen. Here, very small amount though. This is the ascitic fluid, and this is the urinary bladder, seen in the dependent region peritoneal cavity. Now what else is seen is that there is a bowel segment extending from the left upper abdominal quadrant. Here it will come in view. Just wait. these are normal bowel segments, but this segment, this one, now it's seen extending from the left upper quadrant, abdominal quadrant, and I can follow it down up to the not only up to the left lower abdominal quadrant, rather above the urinary bladder. Now in this segment of bowel, in this bowel, whole of the bowel on the left side is seen in thick, dilated, with layered out walls, luminal walls, and at its terminal end, at its suprapubic end, there is an approximately measuring 2.0 by 3.0 centimeter dense, coarse, highly echogenic area, well demarcated, and this is at the distal end of this bowel-related pathology. This area, it also moves. This is the area. This area, this region. And as I move the probe upwards, I see bowel segment, thick bowel segments with clear lumen, collapsed lumen, meager peristaltic movements, if any. I'm going to magnify it for you. So this is a collapsed segment of bowel, this area, this from here. Now movement is seen, yes. Peristaltic movement is seen. This is here, this is here. And this is the lumen. This area is the lumen. And there is fluid around it, you see. There is fluid around this wall. All fluid, this is all fluid, this is all fluid. And here again fluid. And now I am moving upwards to see up to what extent we can see it. So now I am in the left upper abdominal quadrant. Well, this is a bowel-related pathology. The bowel segment, whole of the bowel, starting from the left upper abdominal quadrant and then extending into the lower abdominal quadrant, and from here extending anterior to the urinary bladder in the suprapubic region. Here I am with a dense, coarse, echogenic area at its most distal end. It's being seen. You see, this is the bowel segment. We did see some peristaltic movements. This is the fluid surrounding its wall. This is the pelvic cavity, pelvic region. Lower, the dependent region, peritoneal cavity, urinary bladder, fluid. So bowel, thick bowel, whole segment with fluid surrounding its wall is seen in this patient with cirrhotic liver parenchymal changes. So this is a case of cirrhosis with bowel pathology. this is the transfer section of the same bowel segment. Here we do see some movement. This is to show you the movements. I am placing the probe where I was. I am not changing. Now here you can see the churning movement of this collapsed bowel segment. So this bowel segment is basically collapsed, and there appears to be thick mesentery around this one. This is thick mesentery. This area, this area, this area. So thick mesentery is definitely, no, this is the mesentery, thick mesentery, and this is the lowermost end of this bowel electric pathology. So this is our case of the day, in which we see the patient is having chronic liver disease, cirrhotic liver disease, as well as bowel related pathology, and they have thick mesentery, and small amount of ascites is seen in the dependent region peritoneal cavity. This is the longitudinal section once again, and this is the transfer section, and this is the lumen, and this is the thick mesentery, this area, this is fluid. So this is our case of the day. Thank you very much.